Herpes simplex virus is an STD caused by two types of viruses, herpes simplex type 1 and herpes simplex type 2. HSV1 is mainly transmitted by oral-to-oral contact, which cause oral herpes, but it can also cause genital herpes. HSV2, on the other hand, is a sexually transmitted infection that primarily causes genital herpes. An estimated 3.7 billion people under age 50 have HSV1 infection globally. On the other hand, an estimated 417 million people aged 15 to 49 worldwide have HSV2 infection. With respect to genital HSV1 infection, 140 million people aged 15 to 49 years old were estimated to have genital HSV1 infection worldwide in 2012, but prevalence varied substantially by region. More women are infected with HSV2 than men. In 2012, it was estimated that 267 million women and 150 million men were living with the infection. This is because sexual transmission of HSV is more efficient from men to women. Transmission of the herpes simplex virus is through sexual contact with infected partners. HSV can also be transmitted from mother to child upon childbirth. Most people are asymptomatic, but when symptoms do occur, sores can appear as blisters or rash, which are painful, fluid-filled, and can be seen in the penis, vulva, thighs, buttocks, inside the vagina, throat, mouth, eyes, and fingers. Flu-like symptoms can also happen such as fever, headache, nausea, swollen glands, aching muscles, and painful urination. These symptoms can be manifested after 2 to 12 days from exposure to the virus, and it can last up to 4 to 21 days. Thus, it is important to know that you can still get the infection from an infected sex partner even if he or she is not showing any clinical manifestations of herpes. Cell culture and PCR are the preferred HSV tests for persons who seek medical treatment for genital ulcers or other mucocutaneous lesions. PCR is the test of choice for diagnosing HSV infections affecting the central nervous system and systemic infections such as meningitis, encephalitis, and neonatal herpes. Failure to detect HSV by culture or PCR, especially in the absence of active lesions, does not indicate an absence of HSV infection because viral shredding is intermittent. Direct immunofluorescence assay using fluorescein-labeled monoclonal antibodies is also available to detect HSV antigen from genital specimens. This assay lacks sensitivity. To prevent having HSV1, avoid kissing people with visible core sores. Do not share personal items. Wash your hands frequently. If you have HSV1, be careful touching your eyes and genitals. Do not perform oral sex on your partner. Use sunscreen. Reduce stress. In preventing HSV2, avoid having sex if you or your partner have an outbreak or active infection of herpes. Antiviral chemotherapy offers clinical benefits to most symptomatic patients. Counseling regarding the natural history of genital herpes, sexual and perinatal transmission, and methods to reduce transmission is integral to clinical management.